I'm Dr. Kathryn Rexrode. I'm a general internist and the division chief for women's health in the Department of Medicine at Brigham and Women's Hospital. If I could reimagine the world, it would be one where gender did not have an impact on experience and expectations of individuals in society. One of my first experiences with gender discrimination was when I was interviewing for medical school, and one of my interviewers asked me how I would possibly have a career if I wanted to have children. It is now an illegal question to ask. It made me so mad, so mad. I can remember in medical school having lectures where really everything was phrased as the 75-kilogram man. We can probably assume he was also white and middle-aged. There were no examples of women in the hypothetical patient, except for when it was breast or reproductive organs. But we know that virtually every cell in the body is affected by biologic sex. The influx of women in medicine absolutely expanded the attention to how women might be different. And we know that whenever we bring in diverse populations, that their lived experience will affect the kinds of questions that they ask in science. Women are 52% of the population, and we're interested in all of the things that affect their health. Many of those things might be the same as for men. But there are many areas where either biologic sex or the experience of gender in our society will affect their health. Both biologic sex, which is hormones and chromosomes, and sociocultural gender, which is our experience of gender in our society, have profound implications on health. Women's hormones change over the menstrual cycle, and so a higher estradiol level might have a particular effect on a diagnostic test, for instance. That's biologic sex. On the other hand, in a study that was examining personal care products and the environmental endocrine disruptors in those products, women used more personal care products and thus had higher levels of these chemicals than did men. That's gender. And so that's an important thing to think about, all of the different ways in which a patient might have different exposures. Women's health has historically been understudied, underfunded, underappreciated. The consequences of that are that we lack knowledge about many conditions that predominantly affect women, solely affect women, or the ways in which sex and gender influence different disease processes. The first thing I need to know if a drug, for instance, is as effective in women as men is what's the data look like? And still, in many studies, results are not disaggregated by gender. Cardiovascular disease in women presents quite differently. Again, we have defined that disease in sort of the classic male presentation. There are potential benefits for men as well, because we're looking at biologic mechanisms that might have been overlooked because we were looking in a different population. I am tremendously excited by the Women's Health program at the Wyss Institute. So many researchers are looking at how there are unmet needs in women, how sex and gender might influence diagnostics or therapeutics or med tech. I'd love to see a day when we don't need women's health. Until we get to that day, that is exactly the kind of research we need.